And joining us are Connie Wille, Executive Director of Champlain Valley Family Center, which provides substance abuse treatment, counseling, and education. And John Bernardi is the Executive Director of the United Way of the Adirondack region. Both of you are members of SPARCC, which is a coalition made up of community leaders trying to raise awareness about the opioid and heroin epidemic in the North Country, treatment options, prevention, and eliminating the stigma of addiction. Thank you both for being here. We appreciate it.
Thanks, Tom.
Thanks, Tom.
You were both at Senator Schumer's announcement the other day. How critical is this funding from Congress?
Well, I think it's absolutely essential, and I'm glad to see that the federal government is recognizing the epidemic that all of the states are experiencing with opiates and heroin and fentanyl, and additional monies will be going out to the states and to the North Country to help support what we're doing and hopefully enhance it.
And it sounds like there's an urgency. At that news conference, the senator talked about, okay, we've finally approved this money, now let's get it out to the communities that need it.
Well, it's a real crisis, Tom, here in our region and across the entire state and across the entire country. It's a major crisis. It's an epidemic. People are dying, families are being broken up, people are being incarcerated. It's a real crisis. And one of the things that the funding that Senator Schumer spoke about, which represents a collaborative effort among various community partners.
$3 billion nationwide. We don't know how much that translates into for the North Country, although when asked about it, the senator thought with the border close by, he thought that it would be in the millions here for the North Country, which could make a huge difference.
I talked with some law enforcement officials afterwards, and I think that they're very excited to have the fentanyl detector come online, and I heard Senator Schumer say his goal is to get it in post offices and on the border and in the hands of law enforcement, so that can be much more easily and quickly detected.
Because it is so dangerous for them. But
Yes.
if they don't know it's there and they touch it, it can be deadly to law
Yep.
enforcement.
Yep.
And so these detectors that the senator's talking about can instantly
Yep.
detect fentanyl. And so much of the heroin that's ending up in the North Country now has fentanyl in it in different concentrations. But as we heard the senator say, so potent, 50 to 100 times more potent than heroin alone.
Yep.
It's responsible for a growing number of overdoses and deaths.
That's exactly right, Tom. That's what we're seeing in the North Country.
And so when we hear Senator Schumer and Sheriff Favreau, who we just heard from a few moments ago, talking about the importance of getting the funding out there, getting the training ASAP for the officers who respond and have to deal with the fentanyl, this truly is critical to try to get it out there as soon as possible.
I think putting the dollars on the street, and I understand that it has to work its way from the federal government and then put out to each of the states. There'll be some time, but the sooner the money hits our area, it will go to the boots on the ground.
The other priority that the senator talked about was treatment and expanding treatment. How important will it be to expand treatment options here in the North Country?
Well, through a lot of hard work, Champlain Valley Family Center is really getting positioned to enhance their services. We recently, in December, we moved into new outpatient clinic space where we've been able to add clinical staff to our pattern, and we've been able to open up access. That means that Monday through Friday, all anybody has to do is to walk through that front door and let us know that they're seeking services, and we're going to get them seen that day, if their schedule allows. We've had some folks that couldn't because they had another kind of appointment, but that's our goal is to rapidly engage. In addition, we have a capital project going on in Schuyler Falls, and we're hoping that facility is opened in October.
And is that both detox and rehab?
It is. We'll have 2 operating certificates under one roof, so we'll be able to provide those important withdrawal services. And for other folks that need longer care, we will be able to keep them there, manage them, and get them into recovery. We'll be able to have longer lengths of stay.
And as we've heard for so long, and right now folks have to go away either to Albany, Canton, Potsdam, and often that can be a deterrent to many people if they have to wait for some period of time or travel a distance to get help.
It's absolutely true. And right now, Canton Potsdam is in the process of closing their beds, their detox beds, and they're being transferred to Gouverneur, which is, again, farther.
Are there other treatment facilities starting up or opening, or at least seeking, looking to open in the coming months? Is St. Joseph's in Saranac Lake
Yes.
looking as well?
Yep, St. Joe's has, I believe, also a capital project in terms of providing detox services in Saranac Lake.
Realistically, how many beds are needed here in the North Country?
I don't know the answer to that. We're opening up 18 beds, and after we've been open for a year, I hope you ask me that same question, and I will be able to answer.
Do you think that having immediate treatment available will make a difference, though?
Yes, absolutely. Yep. When people are in withdrawal, that's when they want treatment or need treatment, because if not then the likelihood of them going back out and using is astronomical.
We heard the senator at his news conference
Yeah.
talk about the father who cried in his arms because his son, a heroin addict, was put on a waiting list for 23 weeks,
Yep.
got to week 22, was a week away,
Yep.
and died of an overdose.
Yep. I would love to see those wait lists just go away.
At the senator's news conference, he was joined by one of your counselors, Terry Champlain, who shared her story of growing up abusing alcohol and then opioids and heroin and becoming an addict.
In 2013, I found my mom dead of an opiate overdose, and a few months later I used for the last time. I got my credentials for counseling in 2017, and I've been working in my dream job for a year. Why not take the thing that almost destroyed my life and make my life's work out of it? Thank you.
You mentioned at the news conference how important it is to share stories like Terry's that for many years weren't talked about. If people were addicts, it was often kept hidden.
Yep.
And that's changing. This has to do with getting rid of the stigma.
Right. I got into recovery June 30th, 1985, and up until 2 years ago, I have kept that information just very private, cloistered. And I think for a lot of folks in recovery, certainly for me, it's that fear of being judged.
And that's a big part of what SPARCC does, right, John, is really trying to deal with the stigma.
Absolutely, Tom. One of the main challenges we have is to really try to celebrate recovery, glamorize recovery. We want people to come out of the shadows, if you will, and be proud to want to get well and feel better. It's not helpful when people are stigmatized and made to feel ashamed of their disease, and it is a disease.
So many people now know someone who is directly impacted by this. If parents are either in recovery, getting treatment, or if they're incarcerated, it creates a crisis for the family. And if there aren't relatives to care for the kids, they have to go into foster care.
We have seen a dramatic increase in the need for foster care across the entire Adirondack region. This has been going on for a while, several years. It's exacerbated greatly by the heroin and opioid epidemic. And in some cases, you're seeing the need quadruple in the past few years. Franklin County, for example. What's happening in many cases is that we're needing to send children outside of the region for foster care. This creates a bad situation on many different levels. First of all, families, of course, are being broken up, but also children are being removed from their school districts or from being near relatives or friends and having to leave the area altogether. It's traumatic enough for a child to be put into foster care, and when you add such a distance, it creates even more trauma. We have an urgent need for foster care, and one of the things we are continuing to do is to raise awareness about this urgent need in hopes that it will spark interest so that people might want to find out more about what it would take to become a foster home.
Is there a sense that we're making progress tackling this epidemic?
We've made some progress, but we have a long way to go, and it continues to be a major crisis and an epidemic. I think our activities have been helpful, and I think we've moved the dial a little bit in a helpful way. But are we close to eradicating the issue? Not even anywhere near close.
Yeah. And I think that from the treatment perspective, exactly what John just said, that no, I think that services, what we've been able to do through SPARCC is get the message out there that treatment services are available in this county. There are 3 programs that are here and they're all ready to help. And so I do think that all of the programs have really improved their access to service. Mm-hmm. But in terms of the epidemic, no, I don't believe that we've made anywhere near progress that we would like to see.